I'm Joe Graydon.
And I'm Terry Graydon. Welcome to this podcast of the People's Pharmacy.
You can find previous podcasts and more information on a range of health topics at peoplespharmacy.com. Have we been too careless with antibiotics? Fluoroquinolones like Cipro and Levaquin have some unexpected side effects. This is the People's Pharmacy with Terry and Joe Graydon.
It took decades for the FDA to warn about tendon rupture with fluoroquinolones. Other unanticipated complications include aortic aneurysms and nerve damage. What other problems might patients experience with such antibiotics?
Gout affects 8 million people in the United States. The pain can be excruciating. What causes gout and what can you do to prevent an attack?
Have you ever peed when you sneezed, laughed, or lifted something heavy? Stress incontinence is a delicate topic, but very common.
What can be done?
Coming up on the People's Pharmacy, health updates that matter to you.
Welcome to the People's Pharmacy. I'm Joe Graydon. I'm a pharmacologist.
And I'm Terry Graydon. I'm a medical anthropologist.
Today we're talking about the health news that matters to you. Have you ever had a gout attack? It can be excruciating. Once called the disease of kings, gout is actually surprisingly common. Find out how to prevent it and what to do about it if it happens.
Have you ever peed a little when you coughed or sneezed? It's so embarrassing. Stress incontinence affects a lot of women, but you don't have to suffer in silence. There are some treatments that can help. We'll talk about that later in the show. But first, we're discussing the dangers of excess antibiotic prescribing.
To learn more about this increasingly serious topic, we turn to Dr. Sarah Cosgrove. She's an infectious disease physician, the medical director of the Department of Antimicrobial Stewardship at the Johns Hopkins Hospital, and a professor of medicine at the Johns Hopkins University School of Medicine.
Welcome to the People's Pharmacy, Dr. Sarah Cosgrove.
I'm so happy to be here today.
Dr. Cosgrove, we have looked on antibiotics for almost half a century as silver bullets. Patients love antibiotics, and so do doctors, because they work so well and they save so many lives. But it's reached a point where maybe our love affair is coming back to bite us in the butt. In other words, somebody says, I've got a sore throat, doctor, please give me an antibiotic. Or, oh, this sinus infection is driving me crazy. Can't you give me an antibiotic, please? And a lot of times doctors will go, okay, just to get the patient out of the office. Sure, here's a broad spectrum antibiotic. It can't hurt, might help. And away the patient goes with a smile on his or her face. What's wrong with that approach?
So that's a great question. And, as you said at the beginning of your comments, antibiotics really have saved innumerable lives and have made a huge difference in how we practice medicine today. And for that reason, those of us who are interested in the administration of antibiotics and doing it in the best possible way have the utmost respect for antibiotics. And we want to make sure that we have antibiotics available for all of our future generations. For patients who are not in the hospital and are coming into the doctor's office, in the vast majority of circumstances, they're coming with a cold. And colds overall are caused by viruses and not caused by bacteria. And so even if they've received an antibiotic in the past, that antibiotic probably before didn't actually do anything, and that antibiotic now is also likely not to do anything. However, then why on earth does people sometimes feel better after they get this antibiotic that some of us would prefer that they not receive? Well, in reality, colds have a natural timeline of getting better. And often by the time the person is sick of having the cold enough, tired of being sick with the cold, and goes to the doctor, that they're already about to turn that corner. And so if they do get a prescription for antibiotics, they can confuse the natural history of that cold, that they were already going to get better, with the receipt of the antibiotic being associated with that. And I do think that that has driven a perception that antibiotics help with a lot of these syndromes that are caused by viruses and where antibiotics are not expected to help.
Dr. Cosgrove, there's an assumption that even if the antibiotic isn't really doing anything, at least it won't do any damage. I think we should really look at that assumption.
Yes, I agree. And I think we're more and more starting to understand what antibiotics might do to us that we actually don't want done. There are some basic side effects that I think many people may have experienced related to different antibiotics. Some people have had a rash from antibiotics. Some people have experienced GI upset where you just don't feel good, a little nausea, sometimes some diarrhea that is often pretty clearly associated with taking the pill and then gets better after a few hours. But there are also more serious consequences of antibiotics. First, and the one we definitely worry about in the United States, is a bacterial superinfection, if you will, called C. difficile. And this is a more severe form of diarrhea that results from the antibiotic that we're taking affecting the good bacteria in our guts and then allowing this kind of beastly bug to take over. And that bug makes toxins that cause a huge amount of inflammation in the lower GI tract and can cause very severe diarrhea. And often, if severe enough, patients might have to be admitted to the hospital.
Well, I'd like to talk about a completely different set of side effects that even the Food and Drug Administration didn't recognize was associated with a class of antibiotics called fluoroquinolones, FQs for short. And we're talking about household names like Cipro, Levaquin, brand names that have really penetrated the consciousness of Americans, but the generic names, ciprofloxacin, levofloxacin, norfloxacin, ofloxacin, known by the brand name Floxin, and people have actually taken to calling it being floxed. Now, we're talking about things like tendinitis, which sounds pretty unpleasant, but even something far worse called tendon rupture. But even more surprising to, I think, your colleagues and to a lot of patients is the fact that these drugs can affect the brain. Can you tell us about that, please? Sure.
So just reflecting on this class of antibiotics, I think it's important to note that these are very broad spectrum antibiotics. And what made them become such a part of the public consciousness was in contrast to other broad spectrum antibiotics that we use in the hospital routinely. These antibiotics came in a pill form. And so, whereas if you went to your doctor and for some reason you needed an antibiotic and you were told, oh, you have to go to the hospital and get that antibiotic by vein, most people would say, well, is there some alternative, to that plan? But these antibiotics, despite being kind of what I would consider hospital grade antibiotics, very broad, powerful antibiotics, came as a pill. And I think, unfortunately, that made them kind of really good targets for abuse outside of the hospital. So that's why I think we all recognize those names that you just gave us. And it's also probably why we now are coming to understand some of these side effects related to them, because they've been used so much. So tendinitis and tendon rupture were a couple of the first side effects that came to the attention of the FDA related to the fluoroquinolones, because people would be prescribed these as an outpatient, probably going back to their often usual activities, and all of a sudden have terrible pain, usually in the Achilles tendon, which is the tendon that is that big strip that's between your heel and the bottom of your leg. And if things progressed, as you said, then that tendon can rupture, and then the person cannot walk and will likely have to have a surgical procedure to fix it.
And that can lead to months of rehabilitation. It's a big deal.
It's a big deal, yes. But you had asked me at the beginning of what can the fluoroquinolones do to the brain. And in addition to being kind of these potent antibiotics, most of the fluoroquinolones also penetrate into the brain. And not all antibiotics that we have penetrate into the brain. And for patients that are very ill with infections involving the brain, like meningitis, it's great that we have antibiotics that can penetrate into the brain, because obviously we want to kill those bacteria when they're in that place where we don't want them. However, for most of our oral antibiotics that are used in the outpatient world, they're not getting into the brain. And so there's a much lower risk that they would have any side effects related to feeling confused or sleepy or other things that can manifest are manifestations of toxicity in the brain. And, in rarer cases, patients have become almost delirious on fluoroquinolones, particularly older patients.
Dr. Cosgrove, obviously antibiotics are important when a person has a serious infection. How can we protect ourselves?
Well, I think that there's a few ways. I think recognizing that antibiotics have side effects first is important. And we shouldn't view antibiotics as these really safe drugs that are fine to take, even if the possibility of a bacterial infection is very minimal. So that it is a change in our mindset that we have to make. And once we realize that, I think we have to have a different conversation with our medical providers when we go to see them with a concern that maybe antibiotics are needed. We actually know that there's probably a disconnect between patients and doctors when it comes to antibiotics, that being that doctors will often think that the patient's primary goal is to get an antibiotic out of a visit. But most patients will say, no, that wasn't my primary goal. I may have some feeling from past experience that an antibiotic may help, but I'm not walking into the appointment saying I must have an antibiotic, even though sometimes the doctor interprets it that way. And so what can we do about that? Clarity of communication. So a patient coming in to see a doctor can even say, I'm not coming to ask for an antibiotic. I'm coming because I want your professional advice about how can I feel better. And, we could almost do that, change what we say. Like, I don't actually want an antibiotic unless an antibiotic is truly needed for what I have. And I think if more of the time we did that, then that would change that situation between the doctor and the patient for everyone to be focused on what really needs to happen, which is feeling better.
Dr. Sarah Cosgrove, thank you so much for talking with us on the People's Pharmacy today.
Thank you for having me today.
You've been listening to Dr. Sarah Cosgrove. She's an infectious disease physician and medical director of the Department of Antimicrobial Stewardship at the Johns Hopkins Hospital. She's also professor of medicine at the Johns Hopkins University School of Medicine.
After the break, we'll be talking about gout. How can you take care of your joints if you develop this painful condition? We'll also find out about natural ways to lower uric acid with diet and lifestyle.
You're listening to The People's Pharmacy with Joe and Terry Graydon.
The People's Pharmacy podcast is sponsored in part by Kaya Biotics. KAYA Biotics offers the first probiotics which are both certified organic and hypoallergenic.
All probiotics are produced in Germany under laboratory conditions with high-quality ingredients and under strict regulatory oversight.
The 3 available formulas are created for very specific purposes, such as strengthening the immune system, fighting yeast infections, and helping with weight loss.
To learn more about Kaya Biotics probiotics and the important topic of gut health, you can visit their website, KayaBiotics.com. That's KAYA Biotics.com. Use the discount code PEOPLE for $10 off your first purchase. Welcome back to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. If you would like to purchase a CD of this show, you can call 800-732-2334. Today's show is 1172.